here representing IDEO. IDEO is an organization, a design and innovation organization, and that's to say we cover a lot of bases. Everything from what you would very traditionally see as design disciplines, consumer product design, and that is about maybe a third to a half of the work we do globally as an organization with 500 people across 8 offices. But increasingly, we've realized that the solutions to design problems lie in understanding systems. And over the last 10 or 12 years, we've been applying our design tools, which once helped us design consumer experiences, interactions, to apply to much larger systems. And that's why nowadays we have a pretty large service component, and we've certainly been involved in quite a few healthcare experiences and hospital designs. I represent Medical Products Group. These are all products at IDEO, products and services, and you can see here a couple of sort of hospital environments hanging around in here. In a hospital, a system includes people. It includes patients, it includes all the clinicians, all the staff, and it can't simply be reduced to data. How can you possibly navigate all that complexity and decide what is important here? What things should we optimize for? Are we optimizing for light? Are we optimizing for the experience of the nurses? Are we optimizing for efficiency? I mean, at the end of the day, health outcomes are what matter, but those can only be measured a long way down the line. And if you're planning for an uncertain future, as you're talking about with the future technologies coming in, how can you actually create some core principles and choose some directions and say, okay, well, we can't measure the outcomes out 10 years from now, but at least we can try and drive the experience in the hospital to be something that's more beneficial. And we know that the experience of clinicians and the experience of patients is one good indicator of what the outcomes may be in the future. So to get more specific, this is the design of a product. This is a Medtronic stealth station. But this is a great example of a product which is also a system. When this goes into an operating room, you're actually looking at a very complex interaction between the surgeons, the nurses, circulating nurses. There are multiple roles and multiple dynamics playing out in that space. And so IDEO has put a lot of work into human factors research techniques, where we spend a lot of time in context trying to understand what it is that makes these successful and trying to map those dynamics and coming up with human-centered design principles which enable you to navigate complexity. And that's to say, a hierarchy of what really matters, what will make this successful. And very often that's expressed in a framework. This is part of a document which formed a framework for Medtronic. And what that is a visual map of these relationships. It's saying, okay, this is what we saw in the world, and this is a direction which would actually resolve some of the issues we saw. And let's now use that to filter our concepts and look at the individual design decisions we'll be making along the way and say, does that design decision map to the big picture that we think we've found here? Does this all feel like it hangs together? I was very excited to hear you talk about building prototype, life-size prototype OR rooms to test out the concepts. That I feel is an extremely powerful way of taking abstract decisions which at the time you're making them exist in the abstract, are based on hypotheses, analysis, and testing those out. And we believe once you have a hypothesis, you want to move as rapidly as possible to testing that out in some real way with real people, because it's the experience that real people have in these spaces that's going to drive if your decision's successful or true or not. And there's no other way of really finding out except testing it. We've also worked a lot in innovation processes with healthcare delivery, people in the healthcare delivery space. We had a long-term relationship with Kaiser Permanente. We worked with them before the Garfield Innovation Center was set up. We worked with them in understanding how they could drive innovation into their facilities. And this is the outcome of a project that we did with them around the perinatal journey. And what's important about this is not this board, although this is a detail which was eventually implemented in, I think, 40 hospitals to help clinicians understand where each patient was in the process of checking out, and more importantly, communicate to the patients where they were along their journey. What's most important about this is the process by which it was designed. So we worked with Kaiser Permanente, and it was the nurses themselves who designed this solution. They had time set aside in their day so that they could diagnose what problems they'd encountered during the day, what were the big challenges, They could create prototypes. Very often, you know, in the evening, they would have a bit of time together, say, well, I think it would be much better if we'd maybe put something up on the wall. They'd create a simple poster, say we'd write things on during the day, and the next day they'd test that out and come back at the end of the next day and find out, did that work? So this final solution, which came out as these simple pegboards where you rotate something when it has been done, were their solution. But more importantly, that process was their solution to innovation, was actually including the stakeholders in the process of observing what the challenges were, suggesting possible solutions to those challenges, and then implementing them in a very simple way and testing them out. In a very similar way, we've worked in the design of hospitals by being guided by the user experience. So this is a project we do with DePaul Health Center, looking at development of a new facility for them. And one of the things we did, along with a lot of stakeholder interviews and understanding what the sort of technical limitations were, the ideas that they were considering, we tried to experience the hospital for ourselves from a point of view of the patient. And so this is one of our human factors researchers, Christian Simsarian, checking into a hospital and going through a full checkup, and with a video in his hand. And we actually ended up showing the video that he created. A good 5 minutes we showed to the executive team at DePaul, and this was what they saw most of the time. And you realize that one of the key parts of the experience of being in a hospital was staring at a ceiling for a very long period of time. It's sure going to affect your perception of what quality experience you had by what that ceiling looks like. It's really trivial, but it is actually going to have an impact on people's experience. But the other thing that happens is you see sort of people coming slightly into frame here and talking about the patient as if they're not there. And so the patient is kind of left to lie there as a discussion is going on around them, and it's kind of alienating. And you watch this video for 5 minutes, and the emotional impact of just, I feel very disconnected from what's going on here, shows this kind of unity of environment and service and behavior. And so if you have some core principles, if you create, and that's sort of back to what these images are, what we try and create are experience blueprints, a map of what would be the story that you want to create with a patient, or you want to create with healthcare providers. You can also look from both of those point of views. And using that to create a blueprint, express what are the values you want to come out of this, what's the experience you want to generate, and then use that as the filter for the concepts that you have. Now, that's not the only filter you're going to have. There's a lot of other issues out there. But as designers, the design tools we have of prototyping, of human factors research, in-context observations, that's how we collaborate with people like architects and hospital administrators, facility planners, to try and design new experiences in healthcare. We've done similar projects around Memorial Hospital, Leighton Heart and Vascular Health Center. This is talking about a patient journey, wayfinding. How do you make yourself how do you find your way through the journey from check-in to finding the departments you're going to? There were lots of little touch points in there, like maybe you could have a guide which tells people what the journey is they're going to take, and they actually can see into the future a little bit, and then that matches up in terms of signage and color charts into a journey that they go through. This is a waiting room that we designed as it was implemented, thinking very much that one of the experiences in a hospital is waiting around a great deal. This is a space that can be converted. Because it's in a vascular health center, some people are in the waiting room for a long time with loved ones in extremely critical conditions. So we created waiting rooms which could easily be converted into private spaces, and also people would sleep there easily. I think that's where I'll leave it, but thank you very much.